Vous avez un véhicule bien entretenu, en bonne condition? Ça tombe bien, c'est exactement ce qu'on cherche chez Gervais Auto. Paiement le jour même, transaction rapide et sans tracas. Pas mal mieux que sur Marketplace, hein? En février, faites affaire avec la référence en Mauricie. Rendez-vous sur le gervaiauto.com. En février, l'équipe Gervais Auto continue de grandir. On recrute des représentants des ventes, des mécaniciens automobiles et des pros de la finance dans le domaine de l'auto. Ça t'intéresse? Envoie-nous tes infos maintenant à rh@gervaiauto.com.
The Premier and the Health Minister made it pretty clear yesterday. The reason we're going on this 28-day quasi-lockdown, the reason why we're seeing these changes is because they're worried about the capacity of the healthcare system. So let's check in on that healthcare system and see if it can survive another wave of COVID-19. Joining me on the line is Dr. Francois Marquis, Head of Intensive Care Services at Maisonneuve-Rosemont Hospital. Hi, Dr. Marquis. How you doing?
Actually, I'm doing good.
and since the last time we spoke, how have things been at your hospital?
Actually, they all been very, very busy. So we took most of the summer preparing for the second wave because we kind of saw it coming. So we are jam-packed on all the equipment. So the challenges of the second waves will be completely different compared to the first one. So equipment-wise, we're more than ready. That's the easy part. For the treatment of the patients, actually, we know much better how to treat them and how to take care of them. The real challenge right now is my real huge lack of personnel, nurses, and all the other people in the hospital. That is the biggest challenge of that second wave.
Let's talk about that big challenge then. Why is that your challenge? Did we see nurses? Did you see nurses say, that's it, I'm retiring or I'm resigning? Why does that put you in a position where you're worried about it?
So first, part of the problem is that when we had the first wave, we basically stopped everything in the hospital just to take care of the COVID. So we had this huge increase in the amount of nurses that was absolutely an artificial increase in the amount of nurses. Now, right now, a lot of the nurses that were almost ready to retire, actually, they decide to retire. A lot of nurses also, they're very tired, and they actually have not like full-time jobs, and they were giving a lot of disponibilities, and they were working on top of their part-time jobs. Now they don't want to do that anymore. And on top of everything, most of those nurses, they have young kids. So when the young one starts coughing at school, they have to pull the kid out of school, go for the COVID test, and that will, it creates a lot of absenteeism.
Yeah.
And because of all that, put all that together, and after that, the nurses, they know that they can work in pretty much any hospital, so they tend, for a few of them, they decide to go where it's maybe less busy than Maisonneuve-Rosemont. So they're switching hospitals. So if you put all that together at the same time, like half my nurses are not there.
Geez. So we're with Dr. Francois Marquis, Head of Intensive Care Services at Maisonneuve-Rosemont Hospital. I'm still thinking about what you just said. Half your nurses are not there. But Dr. Marquis, here's my next question. The province said hospitalizations up, right? Like week over week, up 50%, right? Mm-hmm. How many more weeks could your hospital, Maisonneuve-Rosemont, go with a 50% increase in COVID hospitalizations? How many more weeks could you handle 50% more COVID patients before you got to your max?
Well, actually, that is a really good question because it's a two-part question. If you're telling me right now, today, I'm pretty much near my max right now. Now, this being said, we're keeping busy trying to increase our capacity. So today or tomorrow, we're shoveling the units inside the hospital to increase that capacity, including the critical care capacity. And on top of that, what is very different than the first wave is that the first wave, a few hospitals were selected, and we just sent all the COVID to those hospitals. And we waited for them to be completely filled to the brim before sending COVID to other hospitals. Right now, we're going to share the load of the patients between all the hospitals. So I'm going to increase, for example, to 25% my total capacity, and then all the other hospitals must be at 25% before I increase to 50%, to give you an example. And something different that we have to consider for the second wave is that the government said that we have to continue doing all the usual hospital stuff, like the surgeries and chemotherapy and all that stuff that was short-circuited in the first wave. Now, I do understand that it's quite important to do that because we never made it through like the backlog of the first wave during the summer. But at the same time, if you're asking me how much can you take care of, how many patients can you take care of in the second wave, if you stop everything like the first wave, I'm going to tell you much more. Mm-hmm. So part of the challenge is not stopping whatever we're doing, on a day-to-day basis in the hospital.
Is that the worst-case scenario? You get to a point where you've got to stop cancer treatments?
Well, this is like plan E or plan F, but can we go there because, no one is listening to the government and we get a huge second wave? Yes, because that second wave could be bigger than the first one. And if you're just telling me that the second wave is going to be exactly like the first one, I don't see right now with the amount of nurses that I have how it can be possible to continue all the other activities. Now, when you're stopping activities in the hospital, you have to prioritize them. So I can be assured that chemotherapy and urgent surgery and that kind of stuff will be the last things to be touched. But if someone is waiting for an elective surgery, they're going to wait. You know what I mean? Yeah. So there will be choices, but people are making choices when they decide not to wear the mask and when they are deciding to make those parties, because for them, those parties are more important than the healthcare system. So those choices will have consequences. And down the road, all society will have to pay for those choices. And this is why the government and everyone involved in the healthcare system is saying, come on, guys, you have to do your part. I know it's not fun, but it is critical because down the road, those people that will maybe not die of COVID because they're younger, they will completely paralyze the healthcare system for those we actually needed right now.
Dr.
And
Francois,
that is the big message of that second wave.
Dr. Francois Marquis, you definitely made your case here in the last few minutes. Thanks so much for coming on the show.
Thank you for inviting me.
Dr. Francois Marquis is head of intensive care services at Maisonneuve-Rosemont Hospital.